Okay, so we are just going to cover a little bit about rheumatoid arthritis and how it affects our body. Through the slideshow, I might refer to rheumatoid arthritis as RA, but that is just to keep things moving along and save time. We will start off with the etiology of rheumatoid arthritis, and that just means what causes this disorder. However, rheumatoid arthritis does not target a specific group of people. Anyone can develop RA. There are certain factors, though, that can increase your chance of developing RA, and some of those are unchangeable, like our gender, age, genes, and family history. It has been proven that people who are in their 30s to 40s are at a higher risk of getting RA, and women are even higher. And like many other things, our genes and family history also play a role in that. So if we have a family member who had or has RA, that also puts us at a higher risk. Like I said, though, those things are unchangeable and we have no control over them. But there are things that we do have control over, like smoking and obesity. These things have a huge impact on our risk of getting RA. In fact, people who are obese have a 25% greater chance of getting RA, and that is because all the added weight and pressure that is put on the joints makes it even harder for them to move and causes friction and damage to the joints. Some signs and symptoms of RA are pain, fatigue, swollen reddish joints, and you can also experience stiffness of joints in morning hours that can last up to hours long. The symptoms usually occur in the joints of the hands and feet, but they can also spread to other parts of your body, such as your wrists, knees, ankles, hips, and shoulders. If one half of the body experiences these symptoms, the other half will most likely as well. And what that means is that RA doesn't just affect your right arm or hand, and it affects your left as well. So if you experience symptoms in your right hand, you will also experience them in your left hand. Rheumatoid arthritis is an autoimmune disorder, so what that means is that our own immune system attacks our body's tissues, and specifically RA attacks our synovial membrane, which is what surrounds our joints and makes it easier for us to move them. It usually affects smaller joints, such as those in our hands and feet, but in time swelling will occur, joints will become deformed, and erosion of bone will happen, which is shown in the picture off to the right-hand side of your screen. Our body can be affected in many ways by RA, and skin is just one of them. Due to certain medications that we take, our skin can become thinner, and we could also develop rheumatoid nodules, which are lumps of skin that form around bony areas exposed to pressure, like our elbows and fingers. Gum disease and inflammation of the eye also seem to be associated with those who have RA, and those who have RA are also 2.5% more likely to develop cardiovascular disease than the general public. That is most likely because inflammation of rheumatoid arthritis can spread to blood vessels. A third of people with RA will develop some type of pulmonary system or lung problem, and the nervous system could also be affected by RA because it is common to experience numbness, tingling, and or weakness in the legs and arms for those who have RA. One other disorder that is commonly found is carpal tunnel syndrome, and that disorder is where the nerve running along your forearm becomes inflamed and compressed by tissue. It also becomes extremely painful for those who have carpal tunnel syndrome. There is no way to really determine the consequences that a patient will have from rheumatoid arthritis. It all depends on the severity of their condition and medications that they're taking to cope with the pain and discomfort. However, most consequences occur after long-term use of medications for managing the condition, and those areas could be the lungs, the eyes, the mouth, liver, lips, or even heart. Unfortunately, there is not a cure for rheumatoid arthritis. However, there are a variety of different treatments and medications to ease the pain and discomfort. Most common medicines that are taken by those with RA are corticosteroids and NSAIDs. Corticosteroids are potent and quick-acting anti-inflammatory medications. They have also been known to put arthritis in remission with long-term use. NSAIDs are non-steroidal anti-inflammatory drugs, and they come in a variety of different medications, with their main purpose being to ease pain and inflammation. Those with RA have also been known to participate in occupational and/or physical therapy, and that is to keep their joints moving and keep being active, which is important for anyone to stay active, but it is really important for those with RA to keep active and keep their joints moving to help with the pain and discomfort of their joints. And with that being said, that is the end of my presentation. I hope you guys all learned a little bit more about RA and the effects it has on our bodies, and I would just like to thank you for listening. Thank you.